So please list the antianginal drugs. Abdulaziz,
Yes,
could you please answer the question?
yes. Metoprolol.
Metoprolol. Okay.
Mhm. And ranolazine.
Ranolazine. Okay.
mm, Nitroglycerin.
Nitroglycerin. Okay.
mm, and nimodipine. That's all I know.
What?
Nimodipine.
Amlodipine.
Yes, amlodipine.
Any more?
That's all I know.
Uh, do you have a textbook?
Yes, I'm looking. What page?
I don't know. I don't remember the page. Chapter number 21.
Chapter number. Mhm.
Use a contents at the beginning. The page is written there.
Ah, okay. Chapter number 21. 280.
What is the page number?
281.
281. Please, everyone, please open the page number 281. Jasmine, please open the page number 281. The topic is anti-anginal drugs. So, Abdulaziz, could you able to find the drug list?
I'm looking for it.
So, anti-anginal drugs, page number 281, chapter number 21.
There are four type of drugs.
Okay, what is the first type?
Uh, uh, beta blockers,
Beta blockers,
calcium channel blockers,
calcium.
organic nitrate, and sodium channel blocking drug.
Okay. What are the uh, beta blockers?
Uh, beta blockers. Beta blockers like atenolol, indolol, propranolol, and metoprolol.
Metoprolol.
Mhm.
So, and what are the organic nitrates?
Mm, organic. Organic. Mononitrate and nitroglycerin.
Nitroglycerin and isosorbate mononitrate and isosorbate dinitrate.
Mhm.
So these are most commonly used drugs, and then also the calcium channel blockers are also effective for the angina pectoris.
Mhm.
So what is angina pectoris and what are the symptoms of the disease? Jasmine, what do you know about angina pectoris?
Antianginal disease.
Sorry, what?
What was the question?
What do you know about angina pectoris? So what is the disease? What are the symptoms?
Chest pain,
Chest
discomfort.
pain. Okay, good. The very severe chest pain is a common symptom.
Because it don't get enough oxygen rich blood.
Indeed, there is not enough oxygen, and that is why the pain.
Yes.
So, and the principal mechanism for the treatment is increasing the oxygen delivery or
Yes.
decreasing the oxygen consumption.
What is oxygen assumption?
Consumption is how much oxygen is consumed by the heart.
Ah, okay. Mhm.
Like if you don't have food at home, you have two ways. Or
Your body have to reduce metabolism.
yes, you have to cut your diet so you
Mhm.
can save your food that is left at home, or you can order food uh, online.
Mhm.
So if you cannot go out from home, so to buy food yourself, so you can order it. So this is the uh, so the same is with the oxygen. You can deliver more oxygen, so as you can order more food, or you can decrease the oxygen use, so you can eat less, so you have the food you already have at home will
Mm.
last for a longer time.
Yes.
So and the uh, organic nitrates will uh, increase the delivery and also decrease the demand. So they do both, and that is why they are most effective. So what do you know about nitroglycerin?
Like what?
Like, do you heard about nitroglycerin?
I just heard of it.
Or do you heard about dynamite?
No.
Dynamite,
Dynamos. Yes.
yes? So what is the
Mhm.
purpose of the dynamite?
Explosion.
Explosion, correct. So the
Mhm.
same nitroglycerin is used for the treatment.
How?
So the same dynamite is eaten by the patient, and then it's actually will treat. So same substance. So actually, dynamite was invented by Alfred Nobel, and
Mm-hmm.
the founder of the Nobel Prize, and he made uh, capital, his first capital by studying the dynamite for the mountain uh, coal to the miners. So actually for the coal miners, and then uh, later dynamite become very popular among the robbers. So they explode the banks and get money from the bank, and uh, then so and they so that was the way for the bank robbery, so to become rich. So and then also nitroglycerin was also used to make tablets, so also to become rich because they were very effective, and so the pharmaceutical companies sell much nitroglycerin now. So these are very small tablets that
Mm-hmm.
patient put under the tongue, and they a very fast effect. They have very fast effect, and so this way is sublingual way, and the time for development effect development is about several minutes. So this is very fast for the tablets. And also nitroglycerin is can be taken in orally. So and orally nitroglycerin uh, will be effective in about 15 minutes. So depending on the way of administration, there is different duration of action and also different onset of action. So then the nitroglycerin is very is metabolized, and it releases the nitric oxide, and nitric oxide is a endogenous vasodilating factor that dilates vessels including coronary arteries, and then it increases oxygen delivery, and also it reduces the blood pressure, so it decreases the oxygen demand. So that is why it's very effective drug. And also the uh, long-acting derivatives like isosorbate mononitrate and isosorbate dinitrate are also can be taken sublingually or orally, and they act longer, so the duration of action is longer. So what are the adverse effects of the organic nitrates?
What is?
What is adverse effects? Fatma, what are adverse effects of organic nitrates?
The most common one is headache.
Oh, one moment, Abdulaziz. I want
Mm-hmm.
to ask Fatma.
Okay.
Fatma, are you here? Can you hear me?
Yes.
Fatma, what are the adverse effects of the uh, nitroglycerin?
Okay, one moment.
Jasmine, can you answer the question?
Yes, doctor, please again the question.
I just told it 3 times. You should listen.
Maybe I have a problem with the internet.
Maybe or not.
Maybe because it's not
Make
not
sure
good.
next week you don't have your problems with the Ethernet, so you can hear the question every time. So, what are the adverse effects of the nitroglycerin?
What are?
Adverse effects of nitroglycerin. Fatma, could you able to find? Okay, Abdulaziz, what are the adverse effects? Headache
Headache,
and
posterior hypotension.
what is the posterior hypotension?
I don't know.
It is hypotension that will occur when the patient stands up
Quickly.
fast.
Okay, yes, I know it.
You know, okay, good. So
Uh-huh.
when you lie for a long time and then you stand up fast, have you ever feel a dizziness?
What?
Have you ever felt dizziness when you stand
Yes,
up?
it happened. Yes.
So this happens because of the postural hypotension.
Mhm.
So, and when you take the medicine, then the nitroglycerin, then it will be even more stronger. So, and some patients even can fall down and lose consciousness, especially uh, the old patients. That is why they should take the medicine when they are lying, and still and lie and stay lying after the taking medicine for about half an hour. Any other adverse effects? Fatma, Asma, Jasmine?
What, doctor?
Other adverse effects? By the way, headache will not stop. The headache will disappear after several days. So headache is not a consistent adverse effect. Abdulaziz, what are other adverse effects?
Facial flushing.
Face flushing, so red face, because of the veins of the face are relaxed and blood is going to the face.
Yes. Tachycardia.
Tachycardia is a reflex, so because of the decrease in the blood pressure, the
Mhm.
heart rate is increased by the reflex. So this is a common reflex. Any other?
I think that's all.
Okay, so there are not so many like adverse effects, and they all are not very dangerous. So, and you can prevent most of them. Also, for the headache, the analgesic is prescribed. So when you dispense nitroglycerin, you can also dispense some paracetamol or aspirin from the headache, because most patients will develop headache in the first weeks while starting the treatment. So you can ask patient if he's taking medicine first time, and then advise him to buy a analgesic also from the headache. Okay, then let's go to the beta blockers. So what is the mechanism of action of beta blockers?
The beta blockers decrease the oxygen demand of the myocardium by blocking beta 1 receptor,
Okay,
resulting in decreased heart rate.
Okay, they decrease heart rate. So that is why the oxygen demand is decreased as well, but they don't increase the delivery. So this is the difference. Okay, then how they are administered. So beta blockers actually are in tablets, so they administered orally. Metoprolol is available as injectable, and also beta blockers are contraindicated for vasospastic angina. Sorry, not for vasospastic. So actually they are less effective than nitroglycerin and the nitrous oxide donators. So that is why this is the second line of the group. And what are adverse effects? Fatma, what are adverse effects of beta blockers? Fatma, Abdulaziz, what are the adverse effects?
Feeling tired, dizziness,
So feeling tired, dizziness,
lightheaded,
lightheaded,
cold finger and toes.
cold finger. Okay, then
It affect the blood supply, so it won't reach like the fingers and toes.
okay, so less blood supply. Okay, then
Difficulties of sleeping.
sleeping disorders,
And feeling sick.
feeling sick. Okay, insomnia, as usually the sleeping disorder is insomnia, and also there is a sexual dysfunction for the beta blockers. Okay, these are the adverse effects. So beta blockers have more adverse effect, and but still they are very safe, so can be used in adults. and also except for the pregnant women, they don't have much contraindications. Okay, then what is the next group?
Calcium.
Calcium channel blockers. Okay. What is the mechanism for the calcium channel blockers?
The calcium channel blockers protect the tissue by inhibiting the entrance of calcium into cardiac and smooth muscle of the coronary and systemic arterial beds.
Okay. So the thing is, calcium channel blockers will increase the size of all vessels, and there is a chance that the supply will be not very good for the coronary arteries, because the blood will go to the other arteries as well. So that is why calcium channel blockers are less effective, and also they have more adverse effects. That is why they are not used frequently. And what are the adverse effects? So calcium channel blockers also have tightness, so same as beta blockers, and hypotension, posterior hypotension. So and what are the adverse effects? Jasmine, Hassam, Mohammed. We have 3 Mohammeds, so so I would like at least one of you to answer.
Yes, I hear you, doctor.
So Mohammed, what are the adverse effects for the calcium channel blockers?
Sorry, can you say it again? I didn't hear you.
Adverse effects for calcium channel blockers.
Okay, just 1 second. So, just a second. Side effects of calcium channel may include constipation, dizziness,
Sedation, dizziness,
fast heartbeat,
heartbeat. Okay.
Fatigue.
Fatigue. So fatigue is most common side effect.
Mm.
So like I'm now very fatigued because it's Friday evening and there was a very heavy week of work.
Headache.
Headache. Okay.
Yeah. Nausea.
What?
Nausea. Nausea. I don't know the
Nausea.
word. It's N-A. Yeah.
Nausea.
Yeah. Rush and flushing.
Rash.
Yeah.
And what?
That's all I think.
Rash?
Rush.
Rash.
Yeah.
Okay, good. So rash actually is a contact, like maybe some red skin on the hand. So I think that is it for today. Any questions? So if no questions, then
No.
the next class is the topic is anticoagulant and antiplatelet agents, chapter number 22. Okay.
Okay.
So please prepare the chapter and be prepared to answer the questions. Have a nice weekend and see you next week. Bye bye.
Sorry, what chapter?
20, 20, 22.
22. Okay.
22 anticoagulants and antiplatelet agents.
Okay. Thank you.
My pleasure.
Yeah, I have a quick question.
Oh,
It's
sure.
not related. I couldn't find an answer for it. Why there are less antiviral drug than antibiotics?
Because antiviral drugs are less effective and the most of the viral infections are untreatable or they self-resolve.
Oh, okay.
And also antiviral drugs are very new group. So because we started produce antiviral drugs in 1985 and they are less useful because, for example, most common viral disease is flu is self-resolved
Yes.
and there is now any evidence to prescribe an antiviral drug. So that is why antibiotics actually they have larger history. So they started producing in 1940s. So and also there is large demand because bacterial infections are there are many bacterial infections, much more than viral infections, and they are also more severe and they don't self-resolve. So and also they can lead to the death. So
Okay.
antiviral viral diseases usually they don't lead to the death because the human will develop immunity. So like for example for the COVID, most of the people develop immunity and they survive. So that is why. But for the bacterial infection, that's not true. That is why bacterial infection usually requires uh, administration of the antibiotic. And also the there is one more reason that antibiotics are produced by the yeast, so it's easy to produce. So actually they were invented, they were just found, so because they are produced by the yeast. Like, do you like beer? No, you don't like beer, but still, like, beer is very popular, so it also comes from the yeast. So that is why it's most of the antibiotics are produced from the malt or from the yeast. Like, do you like blue cheese? Abdulaziz, do you like cheese
Yes, of course.
with malt, blue?
What is it?
Cheese with the malt, blue malt.
No,
No,
it's
but you know it is like it's French cheese.
yes.
So this malt is actually produces antibiotic.
Oh. Mhm.
So it's easier to produce antibiotic because it's produced by the malt. So, and that is why there is more antibiotics now than antiviral.
Okay.
So then,
That's all.
if no questions, thank you for your attention and have a nice weekend.
Thank you.
Bye bye.